Hi everyone, welcome to Center of Balance Live. I'm Sinan Pua from Center of Balance, the acupuncturist. I'm just trying to share this live video. So we're gonna start a new topic today. The new topic is about anxiety. So it's about anxiety. What are anxiety disorder? What are anxiety disorder? So I'm going to go to my Facebook page and good morning, Veronica. Good morning. I'm very good, thank you. Hi, Eric. How are you? Thank you. Thank you for being here and supporting the start watch party. Okay, I just shared start watch party. So can you please do it the same with me and just share and leave the comment down here, and as well as say hi to me and give you a thumbs up and tag the people who you know who suffer from anxiety, because this the following series is gonna be all for anxiety. Now what we're gonna do today, I'm going to just share with you what are anxiety disorder. Then further on, we're gonna talk about the anxiety disorder symptoms, the sign of it. Then what caused it. Hi, happy day. How are you? So what caused anxiety? Then further on, we're gonna talk about what sort of people will suffer from anxiety. Okay. Then we're gonna talk about treatment as well. So what sort of treatment available for anxiety attack? Okay. Then what sort of tests that can diagnose anxiety, right? When it comes to treatments, then we can talk about acupuncture for anxiety and Chinese medicine for anxiety. Some other natural remedies for anxiety. And what else? We can talk about anxiety and depression, because these two emotional disorder often come together. They can separately happen, or they can actually come together, right? So I have patients that they're pretty sure they're anxiety, not depression. Some patients say I have depression, not anxiety. I'm pretty good with anxiety. And some patients that I have both anxiety and depression. So what are the difference between them? Then we need to talk about this, right? Then what are these symptoms come from which organs related to that, according to Chinese medicines? Well, we're going to talk about this. And what is the how does anxiety link to stress and anxiety linked to alcohol? Can food treat anxiety, or can food lead anxiety? Wow, very new topic, isn't it? Yes, food can link to anxiety too. Okay, and in the treatment of Western medicines, what can they do for anxiety? We're going to talk about all this in the next 1 or 2 weeks. Okay, so from today on, we're going to focus on anxiety. Okay. So anxiety is your body's natural response to stress. It does link to stress. So what we understand here is when you feel anxiety is actually a feeling of fear or apprehension about what to come. It can be, well, if you've been to school, it can be the first day of school, okay, going to a job interview, or going to see a doctor, going to see an acupuncturist. Acupuncture is a very new treatment for you. You don't know what acupuncture is, right? So going for interview, acupuncture treatment, more commonly giving a speech, if you need to speak in the speech in the public, and that may cause anxiety because there's a fear in there. Then nervous, so fearful and nervous. If anything linked to fearful and nervous and make you worry, then that's anxiety. But anxiety can go away quickly. As soon as you finish those things, you feel relaxed. There's no fearful, there's no nervous anymore. Then you'll be alright. So it is normal to feel anxious about moving to a new place. It is quite normal. Everyone get it, right? Starting a new job or taking a test. I get anxiety when I get tests. I worry, right? This type of anxiety is unpleasant, but it may motivate you to work harder and to do a better job. Now, I'll share with you, all successful men, they all have anxiety. Because this type of anxiety, or they all have fear. Fear and anxiety most likely linked together. Now, let me show you something. According to Chinese medicine, stomach and spleen linked to anxiety. Kidney and bladder linked to fear. You see, this is the organs. And when patients have heart problem, it can to easily get anxious, very easy. When you get anxious, it will lead to heart palpitation as well. Why is that? That's because when the stomach and spleen out of balance, you get anxiety, and the heart and small intestines try to support the stomach and spleen, and the heart can't control itself properly, its function properly. That therefore it leads to palpitation. Very common. When you get anxious, you can't sleep. Very common. That's why we put it in Chinese medicine. Anxiety linked to stomach and spleen straight away, and it can come to here. Now we know that stress, anxiety responds to stress, and stress is controlled by here. If liver gallbladder out of balance, you get stress. So simply anxiety, worry too much, this symptom, it linked to stomach and spleen, and as well as heart, small intestine, liver, gallbladder, fear, kidney and bladder. It can link to multiple organs, but mainly stomach and spleen. That is the main organs. So this, according to Chinese medicine, if we were giving you treatment, what do we need to look at? We need to look at which organs out of balance, then we treat it. But most likely we treat spleen and stomach. Now we know when spleen and stomach function better, You still worry thing when it's coming, get a test, but you'll find that you won't have those symptoms, or those symptoms it won't be that bad. What kind of symptom that will come? What are the symptoms of anxiety? As I just told you, that the palpitation, which increase heartbeat, rapid breathing, restless. You can't have a rest properly. Trouble concentration. You have trouble focusing. You have difficulty to falling asleep because you worry too much. That's anxiety. Or once you're awake, you can't go back to sleep. That's anxiety. Our patient yesterday, he told me that it was too busy and he got out at 2 o'clock and then start to work because he couldn't get back to sleep. His mind was too worried about his work because a lot of work. He need to finish the task of his work. Too many things to do. He didn't get it done on that day, so he woke up on at 2 o'clock and carry on. That's because in his mind, it was too worried and stress. You know, it's stress, and he afraid that he can't finish all everything. That's why he worry about it. That's anxious. Right. Right. Now, in anxiety is a feeling that comes and goes, and if that is a feeling that comes and goes, it's not too bad, right? But and as long as it does not interfere with your daily life. So, in the case of an anxiety disorder, the feeling of fear may be with you all the time. It is intense, and sometimes it actually put you in bed, like you can't do things. Especially when you have symptoms, you can't drive. I have patients when she drive, she get anxiety, to worry that she hit someone. She had a car accident. So this is not good. This is not good. So, like if you go for a test, a new job, or move to a new place, you worry about it. But as soon as you finish that, it's gone. But some anxiety, you just keep having the sensation, the feeling, and the symptom, and it actually stop you doing something that you like or you love. And you can't function properly, you can't work, and that's become an issue. And then you need treatment. You need to seek a doctor, an acupuncturist to help you, right? So this type of anxiety may cause you to stop doing things you enjoy, right? In extreme cases, it may prevent you from entering to a small space, like getting to a room, a dark room, crossing the street, or even leaving your home. Or like you just want to be at home. You don't want to leave your home. And this is not good, right? So the anxiety will get worse and worse and worse. Then you will really need someone to help you. Right. So anxiety disorder are the most common form, is most common form of emotional disorder, and can affect anyone that at any age. Can be very little, suffer from anxiety, or when a very old elderly person or teenager. Anyone can suffer from anxiety. Now, according to the American Psychiatric Association, women are more likely than men to be diagnosed with an anxiety disorder. It's partly because when women have the monthly period bleeding and you suffer from PMS and the hormonal disorder, the hormonal imbalance, it causes the emotional issue as well. And some patients lead to the period and they get anxious. Another thing we want to talk about is expectation. When you have a high expectation, then you worry about that you can't reach the expectation. You worry that people can't reach the expectation, and that creates stress, and that creates worry. Then it put you into anxious. So you need to understand that expectation as well is one of the things, right? Like as a Chinese herbalist, Chinese medicines practitioner, and acupuncturist, patients have an expectation as well. Then we need to let patients know what are the expectations of the treatment they come to us. Okay, what are the expectations of the time frame and they're getting treatment to heal the disorder that they come for. So we need to talk about this, because if you're a practitioner, you're not sure what are the expectations of your patient, and your expectation for your patient, then it will lead to anxious as well, right? Because when we're treating patient, the patient respond to acupuncture even though they responded very well at the beginning, but the condition will always comes and goes. Okay, so set the right expectation for your patient is critical, very important, right? That's it for today. Now, if you're watching this video in our Facebook clinic page, so call us. Our phone number is 078467956. You can call us that we can help you with your anxiety disorder with acupuncture as well as other remedy, right? If you find that any solutions, it could be meditation, it could be singing a song, going for a walk, can help your anxiety or depression or stress, then you should do that. Otherwise, acupuncture and Chinese medicine, we can balance the organs. Oops, where's the organ? We balance the organ and to help you get rid of anxiety. Right? Stay awesome, and I'll see you next time. Thank you. Thank you, Veronica. Thank you, Eric. Thank you for all your support. And I'll see you tomorrow. Bye-bye.